Hey guys, how's it going? I want to quickly discuss about delirium and especially delirium prevention in hospitalized patients. First of all, do you know what is delirium? Delirium is an acute confusional state. In fact, I think I've made a video before about dementia versus delirium. Dementia is also a confusional status. The patient is confused, but that's more than confusion. It's chronic confusion, and they have memory problems. They have problems taking appropriate judgment in a given situation. They have problem communicating. They have problem performing complex tasks, or as the dementia progresses, they may not even be able to perform just simple tasks like using their phone or something like that. So that is dementia. But then delirium could happen in a patient who is just seemingly very normal. Like, I'll give you some examples. You know, if you're caring for elderly people in your family, and let's say that they get hospitalized because they fell and broke something, broke a hip or something. When they get admitted, on the day when they get admitted, they may be just fine. They may say what happened that brought them to the hospital and how they got admitted and all that. But then the next day, you may find that they're beginning to get a little bit confused. They may say the year is 2023 instead of 25. And then the next day, they may not even know where they are. They may be confused about the month, the date, the year, what happened to them. So quickly, an acute confusional status really gets set up, and that's delirium. That can happen from, medical conditions like, broken bones, urine infections, any other infection, electrolyte imbalance, dehydration. So it can happen due to many different things. So if you're caring for elderly people and if they're admitted to the hospital, you make sure that you do a few things, okay? Such as keeping them reoriented frequently. If you go see them in the hospital, keep on reminding them, Mom, this is 2025, it is August, it's the 15th. So keep talking to them frequently, keep reminding them, make sure that the room is well lit. If they have hearing aids, make sure that they have it, because I commonly find that when patients are admitted to the hospital, they lost their hearing aid or at their home, they left it, or they didn't bring their dentures, or they didn't bring their glasses, because it's important for them to really have all those things. If they read a newspaper daily, make sure that you get them the newspaper. If they watch a particular TV channel, make sure that they watch the TV channel so that they keep their orientation cues to themselves, and then they stay oriented. Just Google it, okay? Google it about just delirium prevention in hospitalized patients, and make sure that you do this, because delirium can be sometimes a big nightmare. The primary problem for which they get admitted to the hospital, that might quickly resolve, but the delirium might lag behind, and it might take several weeks for it to resolve. So watch out, okay? Just Google it. I'll talk to you later in my next post. Goodbye.